Hello everyone. I wish I could be with you all today, but as you know by now, I'm out presiding over graduation of the School of Pharmacy. I just want to say how deeply touched I am by this recognition, because truly the UCSF Medical Center is at the heart of my entire career as a pharmacist. And I thank you all, Mark, Sheila, Ken, Josh, and all of my many, many friends in the Medical Center. So in particular, the reason why this award is so special to me is that I, as I said, am a product of this place. I began my career here in the basement of the pharmacy in the unit dose area, and I ended up in the 9th floor pharmacy, the first satellite ever in the nation. And I am the product of visionary leaders. The first was Bill Durzon, who was head of the medical center. The second was Dr. Engelbert Dunphy, who was then chancellor and also chair of the Department of Surgery. And the third was Jerry Goyen, then dean of the School of Pharmacy. First, I have to say that these three men carried out a very bold vision. Graduates of the School of Pharmacy who were highly trained in chemistry and pharmaceutics were very dissatisfied with their practice. They didn't feel that they were applying it in the right way. They complained to the then Dean Jerry Goyen. And he came up with the idea that a pharmacist could be more clinically involved in the care of patients. He, together with Dr. Dunphy, decided to take the pharmacists out of the basement and put them into a pharmacy on the surgical ward. And so Dr. Dunphy gave us that space, and we put together the first ever satellite in the nation on a hospital ward. And finally, Mr. Durzon funded 9 pharmacists in the School of Pharmacy to experiment with this idea. They were all passionate about the notion that a pharmacist could do more to enhance patient care. So when this experiment began, I was a student and I heard about it, and I was completely taken by the idea that I actually might be able to influence patient care. My whole goal then was to become an employee of UCSF. And as I mentioned to you before, I started out in the basement pharmacy, where we were one of the first pharmacies, by the way, to implement unit dose products. I begged to go up to that 9th floor pharmacy, and as the person at the bottom of the totem pole at the ripe old age of 23, I was given the graveyard shift. And at that time, the pharmacist on the graveyard shift on the 9th floor pharmacy was the only pharmacist in the house. That's a pretty scary thought. It was scary then, and it's scary to me now. And I can tell you that that experience was both frightening and exhilarating. But it shaped me because it taught me responsibility. I had to be on my toes, and it taught me teamwork because I was there with nurses and physicians on call. So some of my memories from those days is to be grateful to surgeons. I have a soft spot in my heart for them because they welcomed us pharmacists onto the wards. They thought we were curious creatures up there, but they nevertheless welcomed us. And they really allowed us, while they were in surgery, to work with the nurses to look over medication therapy just as long as we didn't mess with their prophylactic antibiotic therapy. And I recall at the time we were trying to convince them to switch from streptomycin to a newfangled drug called gentamicin because it would be less renal toxic. And then I owe a huge debt to my nurse friends who were really in charge of the service. They were huge advocates for pharmacists, and they welcomed us and taught us along the way many of our clinical skills. There's no question that that 9th floor project took root. Today, every single school of pharmacy in the nation trains pharmacists to practice clinically. Furthermore, every single hospital in the nation has clinical pharmacy services. So I'm particularly grateful to the Medical Center for allowing me the privilege of growing up as a professional here. It's really a special place. And I thank you for including me in the latest transformation of pharmaceutical practice here. And finally, I thank my colleagues in pharmaceutical services, especially Brett Berdowie and Joe Guglielmo, for delivering on the promise that we made 40 years ago. It would be uncharacteristic of me not to leave you with a challenge. We're not finished. Although clinical pharmacy practice is well established in hospitals, there's much to do in the community. So I urge you all, the medical center, nurses, pharmacists, physician leaders, to think about how we might transform the practice of pharmacists in the community so that our patients can have better use of drugs, that there can be better transitions of care, and fewer hospitalizations and fewer medication errors. So again, thank you all. I'm really touched.